Hi everybody, welcome to Healthline. I am Gregory Zarian. How are you? Hope all is well. And guess what? Spring has sprung. Yay, and being in Southern California, we're already outside. Can you tell that when you're driving down the street, people are in shorts more, they're in tank tops, all the heavy jackets are gone and the scarves. It is just beautiful weather. Now, along with spring being sprung, you know what goes along with that? Allergies, sinuses. People are sneezing more, they're coughing more, they're hacking more. I came up with a great word. They're snarfling more. And what is it? Are they allergies or are you sick? So to give you the answers that all of us want to know, and I want to know, I brought in an ENT and a facial plastic surgeon from Glendale Adventist Medical Center, Dr. Michael Bublik. Hi, Doc. How are you?
Thanks for having me.
Thank you for being here. And rumor has it you're a big Hugo Boss fan.
I am, yeah.
Yeah, we're going to give it up to Hugo Boss.
I heard the same thing about you.
Yeah, we love our Hugos. Doctor, so it's allergy season, sinus season, sinusitis. A lot of people don't know the difference between both of them. Let me just start off with, what are allergies?
So allergies, being in Southern California, we basically experience allergies all year. As other parts of the country have allergies during springtime, summertime, we have warm weather all the time. So things will blossom in spring and basically have pollen all over the place.
So is that what that is then?
Yeah.
So because we don't have very strong seasons, is that why we get more sinuses and allergies here in Southern California?
I don't know if that's the exact reason, but we have something called Santa Ana winds in the late fall. So that basically all that pollen that settles in the summertime gets back into the air, and then people get like a second spring. So they get all these allergies when the Santa Ana winds kick in. So allergies you can have year-round basically in Southern California. So they'll manifest as certain symptoms like fatigue and sneezing and itchy eyes and all these constitutional, which are like body symptoms, and nasal symptoms and ocular or eye symptoms, like itchy eyes, runny eyes, and they'll last a long time, which is different from sinus disease, which will be like an infection that you'll have at a specific time. It'll be bad, you'll have a fever, and basically you'll need to get treated with antibiotics, but allergies will last a long time.
I know people that become basically despondent with how bad their allergies are. Now, one question and then we're going to go to break. Doctor, what are allergies? What is that?
So allergies are the body's response to something in the environment, either to foods or airborne allergens or things at home, like if you have a dog at home, the dog dander or the cat dander will give you allergies. Dust mites or dust at home, or mold actually, or even cockroaches if
People are allergic to cockroaches?
Can be. I test that in my allergy panel. So yeah, I've had a lot of patients that are actually allergic to cockroaches. So those are things that are there all year round. And then there's things that bloom during summertime and springtime, like pollens and trees and grasses. So those are usually seasonal, but can have different types of seasonal patterns. But so those things people will respond to by mounting an immune response. So they're sensitized to those typical, those agents in the environment or even foods. And what will happen, they'll eat something that they're allergic to. They won't have an anaphylactic or like a really bad reaction to it, but they'll start to sneeze, they'll start to itch, just a typical type of allergy type symptoms.
I want to come back and discuss anaphylactic as well. Okay, more with Dr. Michael Bublik and allergies when we come back. So here's a question that I'm going to pose to you. What do you think you're allergic to? What do you know that you're allergic to? Hopefully we will answer those questions and share with you what you need to do, and also let you know if you are sick or you have an allergy and how to treat both of them when we come back. Do not go away. Hi everybody, welcome back to Healthline. I am Gregory Zarian, and as I discussed at the top of the show, spring has sprung. Happy spring, and along with spring, there's a lot of things we let go of. It's called spring cleaning. So outside of talking about allergies and sinuses, which is our topic, what are you hanging on to this spring? Like wardrobe and clothing, if you don't wear it, get rid of it. If you have a relationship that you're hanging on to for no benefit for either of you, bless it, say goodbye, and move on. The conversation is all about allergies, and joining us today is Dr. Michael Bublik, ear, nose, and throat specialist, and also a facial plastic surgeon. Now, I know a lot of you have questions in regards to that, but we'll get to that at the end of the show. Doctor, thank you again for being here.
My pleasure.
We were discussing allergies, and here in Southern California, Santa Ana's, pollens, grass, flowers.
Cockroaches.
Okay, really?
Yeah.
How is some... I've never heard that somebody can be allergic to cockroaches.
Oh, yeah.
How?
They just get exposed to it. They have I guess, it's not the actual cockroach, it's what they carry. And so just the stuff that's on the cockroaches and the actual feces and everything that is associated with them, it aerosolizes it and basically gives the patients a reaction, just like a pollen in the air, basically.
So, doctor, how are some people allergic to things and others aren't? What is that?
So some people are kids, kids that are born have asthma, they have
I had asthma when I was a kid.
Skin rashes, and they get certain characteristics or certain genetic predisposition from their parents.
Okay, so it's hereditary.
It could be a hereditary cause of allergies. Okay, it's called atopy. So basically they'll have asthma, they'll have skin findings like eczema, and they'll also be allergic to certain foods, because food allergies are the most predominant things in kids, not airborne allergens.
So airborne allergies, pollen, grass,
Exactly.
dust.
Uh-huh.
Food allergies, and there's a big conversation these days about peanuts and wheat
Yeah.
and gluten-free and everything. Why is it more why are we talking more about this now than we used to 20 years ago?
Yeah, I mean, I think society in general has changed, its perspective on, diet and picking things up a little more conscientiously.
Okay.
I think they've always been prevalent. I'm not sure if there's been, more allergy now than before. But the hypothesis is that basically, have we become really clean at home?
Sure.
So that's not necessarily a good thing for allergies. It's actually not such a good thing, because the more things you're exposed to as a child,
The more you build up an immune.
Exactly.
Isn't it the same thing, though, with all the hand sanitizers and
Exactly.
stuff? Kids are getting more sick because their body's not creating such an immune system toward all that stuff. True?
Yeah, it's debatable, but I think there's definitely theories that lead, or, there's definitely some evidence that points to that. Absolutely.
Back to allergies, what are some of the signs and symptoms?
So let's focus on like the body.
The body.
So fatigue.
Okay.
It's just kind of like flu-like symptoms. You can have that just don't go away.
Okay.
You just have you're tired, you're fatigued, some muscle aches once in a while. Then your nose. So itchy nose, runny nose, sneezing, things like that. Okay. Usually clear drainage, not yellow or green. That won't usually indicate an allergy.
Okay.
And then ears.
Okay.
You can actually have ear itchiness or ear symptoms or ear fullness, just pressure in your ears from allergies as well. And then the usual eye symptoms we think of, like eye itchiness, dry eyes, even sometimes too moist of an eye, so those things.
Doctor, what are some of the eye symptoms?
So itchy eyes,
Okay.
runny eyes, very uncomfortable feeling basically.
And eye drainage.
Eye drainage as well. But clear, usually just clear liquid eye drainage. Signs of allergies are usually type of clear nasal or eye drainage.
As per infection, be it a cold or flu,
Yeah.
there's color to the drainage, true?
Can be, exactly.
Can be.
Yeah.
And what are some remedies?
So for allergies, you can use over-the-counter medications, nasal sprays like Ocean Spray, which is just saline water.
Okay.
Prescription medications like nasal steroids, some of the names like Flonase, Nasonex, Nasacort, there's so many of them out there right now. Antihistamines like Claritin, Zyrtec, Allegra.
Benadryl.
That's one of them.
One of them,
Benadryl's
okay.
one of the stronger ones that you
Okay.
can use, and there's side effects to that usually, it makes you fall asleep.
Okay.
So,
But within all of that, though, doctor prescribed,
Yeah.
go see your doctor
Yeah.
to get treated. Like it comes to you
Yeah.
to get treated for exact, because not everything is great for everybody.
exactly.
Now, so we're addressing allergies. In regards to, you were saying food allergies before we go into sinusitis and surgeries and stuff. Anaphylactic and all of that. What is that for people that don't know what that is?
So anaphylactic reaction is a serious allergic type reaction to something that you're already allergic to. So if a child has a peanut allergy and they're exposed to peanuts, they'll usually or can have an anaphylactic reaction, which is a serious, potentially life-threatening reaction. And what will happen is the patient will have swelling. The most serious complication or side effect of an anaphylactic reaction or consequence is swelling in the throat. And when you have that, you can't breathe. So those need to be treated immediately. So kids that do have certain types of allergies, like peanut allergy, which usually they do not outgrow, it usually stays with them for the rest of their life, they'll need to carry around something called an epinephrine pen.
An EpiPen.
An EpiPen, basically.
And that, I mean, we see on TV and we see in movies that the EpiPen is lodged into the heart or into the arm, true?
I think that's in Pulp Fiction.
Is that,
But
that
yeah,
was in
yeah,
Pulp,
that was in
Pulp
Pulp
Fiction?
Fiction. But
Is that how it's done, or does it?
similar. I mean,
Okay.
usually use a thigh
Okay.
or arm, but yeah, it's a self-injector, so yeah.
And what that does is is that like a cortisone that just opens up the
It's
airways?
an adrenaline. It's basically adrenaline.
Okay.
So it'll basically decrease the immune reaction to the antigen that's been presented. And
People don't go grow out of food allergies.
not all of them. Food, like peanut allergy, tends to stay with patients for
Okay.
likely the remainder of their life.
And what about allergies? The pollen, the dust. Could someone grow out of the cockroach allergy?
You can either grow out of it. They say that some people will actually have a decrease in sensitivity to the allergens with age.
Okay.
Some people, for some reason, I've noticed in my practice, will actually have a spike when they get older. So I've had some patients that are in their 70s who are on an allergy treatment now because they've had allergies their whole life and they haven't outgrown them.
And if you have any questions as to whether or not you have an allergy, this is when you call an ENT doctor.
Yeah.
Okay, so I hope we gave you all you need to know about allergies. If you have any questions, we have a great doctor here that you can make an appointment with. When we come back, we're going to share with you what sinusitis is, talk about polyps, and we're also going to address briefly his facial surgery practice. More on allergies and sinuses when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, and the conversation is all about allergies. And it's about food, it's about dust, it's about pollen, it's about cats, dogs, and everything in between. Joining us is ENT specialist Dr. Michael Bublik, and he's also a facial plastic surgeon here in Glendale. Doctor, allergies hit men and women the same. You said earlier that you can grow out of them, and as you get older, they can spike a bit here and there. So just say I come to your office and you diagnose me with, he's allergic to cockroaches and mites and dogs. What happens from there?
So when patients come in, basically, of course, I do a full physical examination.
Okay.
So we'll talk about, how I look in the nose, make sure they don't have something else besides the allergies, which we'll discuss a little later. But we'll test them for allergies.
Okay.
So I'll test them for 30 different foods and 30 different airborne things, which include pollens, grasses, trees, things at home like dust mites, cockroaches, dogs and cats, and molds.
How do you test somebody?
So we do skin testing, which I think is one of the most accurate ways of doing it.
So that was done to me when I was a kid.
Yeah. So it's done in the office, very painless. The technique now is very, very painless. What's done is basically we have a patch of allergens,
Okay.
and on each patch there's about 10 specific antigens on it. So you just apply it to the skin, 1, 2, 3, since you're doing about 60, so it's about 1, 2, 3, 4, 5, 6. So 6 different kind of pinpricks, but they're really very, very mild and very, very rarely felt, if any, pain by the patients. So once that we see what you're allergic to, then we define that allergy a little more by injecting just a little bit more of that antigen to determine at which point or how allergic you are, because that'll give us a sense of where we need to start our allergy treatment if we do go that route.
So just say you find out from me that I'm allergic to dust. What is the treatment then?
So the treatment is, obviously we tell the patients, you could just basically do symptomatic treatment, which is antihistamine, as we talked about, nasal sprays, clean up the environment at home, avoid certain times of high pollen season. There's a pollen monitor on my website. You can go there and see, the pollen count is high, so let me wear a mask if I'm going to work in the garden, or let me take an antihistamine in the morning so that when I go outside I don't get the symptoms.
So a lot of it is preventative.
Yeah.
And is it yearly or is it more prevalent throughout the year, depending on what comes up more?
It depends on the antigen.
Okay.
So, like during the springtime, obviously certain things bloom. In the summer, you'll have grasses. Santa Ana winds will kick everything up basically in the fall time. So it depends on the time of year and what you're allergic to. So that's a symptomatic type treatment. Let's say the patient's allergies are severe and they can't get by just cleaning things up at home, avoiding certain environments. They'll basically be offered the option to start allergy treatment, which consists of either doing allergy injections or shots weekly over a long period of time, or now I'm actually offering my patients something called sublingual immunotherapy.
This is a brand new treatment.
That's a new treatment, yeah. So it's been offered in Europe for many, many years, but as you know, in the United States, things do lag a little behind because of the FDA for good and bad reasons, obviously. But basically, patients could travel. I have a lot of patients that are from out of town. They travel, they fly every week. So it's hard for them to get allergy shots every week. So what we do is we give them a little dropper, they put it underneath their tongue, and they get their own allergy treatment.
Oh, that's fantastic.
Yeah.
And but you don't have to just travel to get that kind of treatment.
No, you can get it here as well. Yeah.
So we've broke down all about allergies. A lot of people suffer from sinusitis. I used to smoke two packs of cigarettes a day, and I would get tons of sinusitis, and I'd get bronchitis and all of that. What is sinusitis, doctor?
So sinusitis is inflammation or chronic infections or an even acute infection of the nasal sinus mucosa.
All through here?
Inside the nose, yeah. So you have sinuses above your eyes, which are your frontal sinuses, below your eyes, which are your maxillary sinuses, and sinuses between your eyes and behind your eyes. So there's a group of sinuses all around your eyes.
And what are the signs and symptoms of sinusitis?
Facial pressure is one of them. Pain in the teeth. So some patients I have, they come in, they said, you know what, I've had teeth pain every 3 months. And I've actually even had patients that have had tooth extractions or had teeth that were pulled because they were thought they were caused by a root issue in their tooth, but it was actually sinus. It was
interesting.
Yeah.
And is there a drainage as well?
Yeah, they've had drainage as well.
Is it clear, or is there a color to it, just so we can?
So sinusitis usually will have a color to it, either yellow or green.
Okay.
Yeah.
And is sinusitis a cold or a flu as well, or do they go hand in hand?
So sinusitis could start as a cold or a flu.
Okay.
Which is usually a virus.
Okay.
That doesn't resolve, so within 7 or 10 days, now you have bacteria forming in the sinus cavity.
Got it.
And so if you have normal sinus anatomy, you're able to drain that very well.
Okay.
But patients that are predisposed to sinus infections or have a history of sinus infections, allergies, kind of that, what we talked about earlier in terms of that genetic predisposition,
Okay.
then they'll get more infections. They won't be able to be cured just by an antibiotic.
I've heard that some people like to do holistic remedies with sinusitis. They like to do a neti pot. They like to do an eardropper with warm salt water and flush out their sinuses.
Yeah.
Totally, do you?
Yeah.
Totally right.
Yeah.
So you recommend all of that for prevention?
I don't recommend for prevention. I recommend it for treatment options.
Treatment as well?
Yeah.
Okay.
Sinus rinse is good to use when you do have an infection, but it needs to be done cautiously and not just, some patients just say, oh, I'll use sinus rinse, but it won't clear the infection if it's there.
How does someone get sinusitis?
So basically, you can have a cold prior to.
Which you were just saying, okay.
Yeah. Or you basically have chronic inflammation of the sinus drainage pathways. So the sinuses have little tiny holes they're supposed to drain through, and if those close off, you get the pressure in your cheeks, above your eyes, and that chronic type of yellow-green drainage from your sinuses.
Is there a cure for sinusitis? Because I know there's surgery options.
Yeah.
Is there outside of surgery, is there a cure for it or no?
There's a treatment for it.
Treatment.
Some people do get cured with the treatment.
Okay.
But some patients have been on years of antibiotics, 30 to 40 years of antibiotics.
Which the side effects to that are horrible.
Yeah, and you can become resistant to all the antibiotics, and then you don't have any options when you do have an infection.
So just say you have a patient that has no more options and they come in for surgery. What is the surgical? Because somebody would have to go in, get a CAT scan.
Yeah, CT scan or CAT scan is the first thing that I do.
Okay, and just say you see John Smith and he has horrible sinusitis. What are surgical procedures?
So prior to offering any surgery, I'll do a nasal endoscopy, which is a little camera I use in the office.
Okay.
I record it, and the patient can actually see their sinus anatomy. So
Okay.
their septum, their turbinates, which are filtering organs in the nose, and also the drainage pathways. So you can see if you have polyps, so that's a different type of procedure or surgery, or if you just have chronic nasal drainage or a septal deviation, which is a different type of procedure.
How common are polyps?
In my population, pretty common, but in
Okay.
the general population, not very common.
In regards to polyps, are those easy to treat?
They're easier, in terms of, they usually need to be removed
Okay.
surgically, but they have a rate of recurrence if they're not treated medically afterwards.
So, and surgical, is it an easy surgical procedure?
So there's different surgical procedures now. There's something called endoscopic sinus surgery, and for patients that have polyps, it's usually done while they're asleep.
Okay.
It takes about an hour, hour and a half, and they go home the same day. There's no packing in the nose, but the polyps are removed, the sinus cavity is opened, but we don't remove extensive amount of tissues now.
Okay.
What's done now is something called minimally invasive sinus surgery, and sometimes I'm actually even able to do the surgery in the office.
So you dropped off, wait for us, we're done. And as far as sinusitis procedures, what are just a couple?
So one is traditional endoscopic sinus
Okay.
surgery. So that's done while you're asleep, and basically the polyps are removed and the sinuses are open to their normal or more normal draining pattern. So the holes, which are tiny like this and aren't able to drain, we open them up widely so then if you do get a cold, everything can drain out and not cause pressure or swelling.
Love that.
Yeah. And then the other option is something called balloon sinuplasty,
Okay.
which is basically, you know how they dilate the coronary or the heart vessels when they're clogged off? We do the same thing for the openings to the sinuses. So we put a little balloon in there, dilate those open, so they were closed before. Now they're wide open, and nothing stays in the nose. So for patients that don't have polyps or that have minimal disease and a lot of headaches or pressure around the sinuses, it's a great treatment.
Okay, we are going to do our wrap up when we come back and finally share with you what you need to know about Dr. Bublik and facial plastic surgery. Do not go away. Thank you for coming back and joining us on Healthline. The conversation's been all about allergies, sinusitis. Now, you know what to look for. Mostly with allergies, there's a clear drainage. With sinusitis, there may be color attached to it, a green or a yellow, and a common cold can shift you into sinusitis if you don't take care of it. Joining us is Dr. Michael Bublik, ENT specialist here in Glendale, and he's also a facial plastic surgeon. And before we go and nip tuck and have conversations about all that, we're going to address a little bit more before we share with you what can be done. Doctor, I said the word bioturbinates. Did I say that wrong?
Just turbinates.
Turbinates. Yeah. Okay, so it sounds like very sci-fi of me.
Yeah, I mean, I like the term actually.
It's like
yeah.
bioturbinates.
Yeah.
What are they?
So turbinates are these filtering organs that run along the sides of your nose.
Okay.
And with people that are allergic, they become really big.
So they get enlarged.
Enlarged.
Because in the center is your septum.
Exactly. And so between the septum and turbinate is where the air is supposed to go through.
So you're real quickly though, when you breathe in, it's supposed to be
nice and smooth, not
on
turbulent.
both sides.
Yeah, exactly.
And if your turbinates are
Enlarged or your septum is crooked,
which means deviated septum.
Exactly.
So then what is the procedure then to fix the turbinates?
So there's a functional procedure to fix the septum and turbinates. So you reduce the size of the turbinates, but you need them to breathe.
Okay.
So you can't take them out.
Okay.
So you need to save all the healthy tissue and remove the stuff you don't need. Same with the septum. You just need to take out the parts of the cartilage which make up the septum or bone and make it straight. So now you have a nice open airway.
And normally when a septum is deviated, that comes along with horrible breathing. And also, is that part of snoring as well?
It can be, yeah. If you breathe through your nose during the day, and when you lie down at night, you're trying to breathe through your nose, and you're not able to, you're going to open your mouth and snore.
So here's a great thing, though, for all of you that are irritated at your spouse because you get this, it could be that you have a deviated septum. See, I give you more than just allergies here at Healthline. So we've addressed polyps, we've addressed turbinates, we've addressed sinusitis, allergies. And I know there's a lot of people that want to know about facial plastic surgery and the wraparound to all of this. Please tell me.
Absolutely. So a lot of my patients, even patients in their 60s and 70s, they haven't been able to breathe out of their nose for a long time. And so they'll have a septal deviation, as we talked about, or a turbinate, hypertrophy, or enlarged turbinates, and possibly sinus disease. But at the same time, they've had a little bump on top of their nose. So you can address the functional part, which is the breathing, and also the cosmetic part at the same time. And I trained in both, and I'm board certified in both, so I do both at the same time. So patients have a functional relief in their breathing and also a cosmetic relief in their appearance.
In regards to everything that we've addressed, because a lot of people want the quick fix. A lot of people like, oh, I can take a pill and I can get a surgery. What are some basic, easy, simple takeaways that you can share with us that people can do where they don't have to have surgery, they don't have to be on meds and pills all the time?
So, I mean, some patients can avoid it.
Okay.
If they have a strong genetic predisposition, it runs in their family, they're going to be allergic. They're going to need allergy treatment. They're going to have sinus disease. They're going to need sinus treatment.
Got it.
But even for those people, certain things they can avoid. Like we talked about modifying their environment when certain allergens are in the air. They can clean the house, not have rugs around, things that would promote them to have worse symptoms.
So, doctor, we've addressed everything, and within all of it, what are some really great preventative measures that people with allergies and sinusitis can take, and people that don't have it? There's a big conversation right now about air filters.
Absolutely. So HEPA filters, which are a type of air filter, are great for people that have allergies and probably people that don't have severe allergies, to clean the air at home, get rid of the dust and things that are causing them to have reactions.
What about air humidifiers and purifiers? Same thing?
Similar, but HEPA filters are probably the most common and the most effective at purifying the air of antigens at home.
And what are some great things that people can do? You mentioned during the break to vacuum rugs, or do you suggest getting rid of rugs?
Get rid of rugs.
Okay, so rugs.
Wood floors is the best.
Okay, rugs. So if you have allergies, rugs be gone. Get wood floors.
Yeah.
Lots of vacuuming. What about the common cold and everything? Because a lot of people, since they confuse it, what are some great solutions to not get the common cold?
I mean, stay hydrated if you do get the cold.
Okay.
Obviously, all the things to help you get better quickly. Okay. And if you don't, seek the attention of a physician. Flu shots, absolutely. Vaccines for older people, and then just common hygiene, to prevent getting the cold.
Washing your hands.
Absolutely. Yeah.
We have shared here on Healthline quite a bit that when you wash your hands, you I invite you to sing happy birthday in your head at least once or twice and use warm water, and also the whole thing about the whole cloth and the handle and everything, just be very aware. Last question, what is the recovery time after, just say, a sinus surgery?
So some people will have surgery on Friday.
Okay.
They'll go back to work on Monday. Some people will have the procedure done in their office, and they'll go back to work the same day.
So it depends on each case's.
But usually it's very fast these days.
Thank you so much, doctor. So we gave you all you need to know about allergies, sinusitis. I even shared with you what turbinates are. And we all learned today that you can be allergic to a cockroach. Here's the truth. If you are suffering from any of these symptoms and you don't know what it is, pick up the phone, call Dr. Michael Bublik. He will share with you all you need to know, or also call Glendale Adventist Medical Center, 818-409-8000, and they will guide you in the right direction. We are the captain of our ship. There is no reason any of us need to suffer, especially now. Springtime, it's about going outside, spending time with your family, getting away from the computer and living your life. You do not have to be stuck inside or be miserable because of the pollen, the dust, the dogs, the cats, or the mites. Get your life into your hands, because here's the truth. The most important conversation you're going to have is the one about you and your health. So why not have it now? Thank you for always joining us. Find us on Facebook. Go to GAMC Healthline and create more of a conversation with us. Thank you for your time. We will see you next time. Thanks.